So let's look at the white blood cells. This video is specifically about the types of cells and their roles. The white blood cells are varied. There are 5 categories of them, and each has a unique role and it has a unique signature, cellular signature. So let's look at them. So in your notes, which was the first page in your notes where you're creating the graphic organizer for the formed elements, you could have this written up there. So the RBC, and you're noticing all of these cells in comparison to RBC, and you notice that they are larger. So there are 5 of them: neutrophil, eosinophil, basophil, monocytes, lymphocytes. Of these, I would say the lymphocytes are the easiest to identify because they have a huge central nucleus or a dense staining in the middle. Monocytes are the largest in size, so that they're easier to spot as well. Monocytes will be the largest cells. The basophils will have these black, almost dark pigmented particles in it, which is very different from the eosinophil, which will be a 3-lobed nucleus. The nucleus has 3 lobes. And then that leaves the neutrophil with multiple nodes. So neutrophils are also called polymorphonuclear leukocytes. It's a big name, but really what they're doing is most of them are in the blood cells or in the blood circulating. Their cytoplasm will not have granules, they will be pale, and they will have enzymes to digest bacteria. Okay, that's neutrophils. And neutrophils become very active. They're the first ones to attack bacteria, engulf and digest the bacteria. They could have, in case of infection, they could have granules in them. So defensins attack pathogen membranes, so they have also other types of enzymes in them that will destroy the pathogens. They release prostaglandins and leukotrienes, important in the formation of pus, that white abscess that is formed in any kind of if you have any kind of a boil or wart or something and the pus forms, that's neutrophil, because they will attack and engulf bacteria, destroy them, and then in the process they release this gunky material, that's pus. That's your neutrophil for there. Eosinophils, they are only very small amount in the white blood cells. They attack parasites, large parasites. They excrete nitric acid, nitric oxide, and cytotoxic enzymes. So again, those two are for cell destruction. They are created when there is allergic reaction in the body. Common inflammation with enzymes that counteract inflammatory effects of neutrophil and mast cells. So they could be also used for anti-inflammation. So if there is histamines released, so there is allergy in the body, then there would be excessive amount of eosinophils. So that's a good indicator. Basophils are very, very small amount. They accumulate in damaged tissues. They are the one that release histamine that cause cell dilation. So that is, in cases of allergic responses, the basophils release so much histamine that the blood pressure can drop, and you could die of internal bleeding sort of thing. So dilation of the blood vessels, meaning the blood vessels are the blood pressure is dropping. They release heparin, which prevents blood clotting as well. So basophils will somehow make the blood much more thinner, and the blood pressure is going to drop if they release their histamines. And notice they have these dark granules. They are the ones that are storing the histamines. Monocytes, 2 to 8%. They're easiest to spot, as I said. They are large and spherical, and they have peripheral tissues, and they can become, in right conditions, they become the macrophages, the giant eaters, engulf large particles and pathogens. and they secrete substances that attract immune cells and other agents to come to that area. So once monocytes are active, the other cells congregate there. It's like a signal for other cells to get there so they can help destroy whatever pathogen the body is counteracting at that time. So that's a monocyte. And finally, the lymphocytes, 20 to 30% in the blood. They are larger than RBCs. They migrate. However, they can migrate in and out of the blood, right? So they do not just stay in the blood vessels. They could be out in the peripheral tissues. And they are part of the body's specific defense system, which we'll talk about in the lymphatic system. So keep in the back pocket for now. That's your lymphocytes. Lymphocytes are 3 types, okay? There could be 3 types. T cells that strictly attack the foreign cells. The B cells that produce the famous plasma cells that make the antibodies. We have been talking about, they have been in news a lot, B cells. And then we have the NK cells, which will destroy abnormal self tissues or cells. So they're related to cancer cells. So they could be searching for cancer or oncogene type of cells that have triggered the oncogenes. So they will destroy them. So there are 3 types of lymphocytes. This is important. There is a lot of medical diagnosis that happens in present based on the difference in the amounts of these cells present. Because if the number goes up or it's below the threshold, it indicates a disease condition. It could indicate inflammation, infection, or allergic response in the body. The disorders primarily are leukopenia, which is abnormally low white blood cells. Leukocytosis is abnormally high white blood cells, and leukemia is extremely high white blood cell counts in millions. So leukemia is that, abnormally high is leukocytosis, and leukopenia is lower than normal white blood count.